that going. And all right, welcome everybody to our first series here of Getting to the Root of It. And the series number 1 is Leaky Gut. And I wanted to welcome everybody. This is a series that is going to be occurring the first and the third Thursday of each month at 7 p.m. And it's going to be pretty much an educational series. We're going to be, we'll have some different people on from time to time. Dr. Georgia Balsley is our featured guest speaker tonight. She will be on many times to talk from a traditional naturopathic perspective. We've got Patti Sinclair on, who is going to be providing us personal testimonials, and I really am very humbled to have both of these ladies on the Zoom call tonight, as well as I can definitely say that they are really very dear friends of mine, and definitely enjoying this journey that we have embarked on. So with that, I wanted to let people know that we have basically joined arms with an incredible holistic mental wellness company, and they are focusing on the microbiome, which is the gut-brain axis. I'm sure that many of you have started to hear about this, or maybe you've already heard about it, which is great because there is so much science and clinical studies that are coming around into not only through what we have learned, and also what we're sharing, but also in the news. And it's all over social media as well as the newspaper. So it's really amazing that we're kind of in the right place at the right time. And we at this point have been helping so many people in regards to this issue of gut-brain axis, knowing and learning that 80% of the communication, or the neurotransmitters, which are the communicators between the gut and the brain, 80% is developed in our gut. And we're going to be learning about that as we go through this series, and very excited to share that information with you. So to get started, I want to officially introduce Dr. Georgia Balsley from Michigan. She is a naturopath, traditional naturopath of over 40 years, and very excited to learn tonight on some of the questions that I'll be asking. So those of you who are on board here, get your paper and pen out, because she's going to be providing you a lot of great information. And Georgia, just say hi to everybody.
Hi, good evening. Welcome for joining. Welcome.
Awesome. So thank you. So Dr. Georgia, now we have been seeing, as I said earlier, we've been seeing a lot of information out there in the news, and as well as discussions wrapped around this issue of leaky gut. And it seems to be a really common problem with many people out there. Can you explain to the listeners what leaky gut is?
Well, leaky gut, or in our world, we call it dysbiosis, or intestinal permeability. So permeability means something can pass through. Impermeable means that it's blocked, right? And so when the cell walls become inflamed and the junctions, which are supposed to be really tight knit, become loosened, it allows toxins, bacteria, from the gut to enter the bloodstream, creating inflammation. So that is where the term leaky gut comes from.
Okay, awesome. Now, through my studies and research, I'm hearing they predict that about 90% of the American population have leaky gut. What are your thoughts on that?
I agree. I've been practicing, I'll correct you. So I've been a naturopath, traditional naturopath, over 30 years now. And so in our world, we have always addressed the gut. You know, back then, back in the day, we were made fun of because we talked about how all disease, all health issues come from gut. And now look at the science is proving everything that we've been saying all along. And so I totally agree with that, because we have huge issues with the gut. You see it on the television, ads being placed for proton pump inhibitors. You know, do you have acid reflux, heartburn, and indigestion? And they're passing meds and promoting meds like crazy because our gut is really in a really bad way. So I totally agree with numbers.
Yes, and some really great information there. But so through, you know, discussions, again, through some of my research, we, the American people, are really guinea pigs for, you know, big pharma in regards to this, because they're really not getting to the root of the cause. And so how does this really happen? I'm thinking that this really goes back to when we were kids, when processed food was coming on board, Monsanto, so forth and so on. What are your thoughts on that? And you know, how does this really happen?
Yes, that's a great question. So we have to understand leaky gut. When we're talking about leaky gut, we're actually talking about the small intestinal tract. And the small intestinal tract is about the size or diameter of your middle finger. I'm going to do it like this so we don't give anybody a negative response here. So it's about the size of that, and you have roughly 2,700 square feet out of the totality of all your intestines. And there's a lot of folds and protrusions. And the reason they're there is for the maximum absorption of the nutrition or the food that you eat. And so when we have this inflammation, oftentimes that nutrition and food passes through quite quickly, or passes out in the abdominal cavity and creates a whole lot of issues. And so some of the things that can create that is excessive sugar intake. You know, it's estimated at this point an average family will go through, or a person, I'm sorry, not a family, but a person will go through 50 pounds a year of sugar. And I think that's even higher now. So we don't even realize the amount of sugar intake we're taking in, because we're thinking that, you know, going to the sugar canister and sticking it in maybe a cup of coffee. But we don't look at the other outside sources of sugar intake, like ketchup, something so simple as ketchup. You know, and it comes in many different forms. Long-term use of NSAIDs, things like Tylenol and ibuprofen, create inflammation in the gut. It's very hard on the gut. Excessive alcohol intake, because that will totally disrupt the biome. Stress, something so simple as stress, because it changes the acidic structure in our intestinal tract and will also create an imbalance in the microbiome. And yeast overgrowth. And yeast was a really interesting one for me to wrap my brain around, because of the fact I have come out of learning in traditional medicine that yeast affected the population that were really autoimmune, possibly people with AIDS, possibly people with cancer. Those type of people with disruptive immune systems would have that. But would a regular person such as you and I have a yeast overgrowth? And really, it's a very large percent of the populace that has it. And then if you look at the causal factors, many of us fit into those causal factors.
Wow, that's pretty amazing. So I know that, and you know that I've been going through this holistic journey for the last 4 to 5, maybe 6 months now. And I have actually come to the determination that I have leaky gut, because I've tried to lose weight and I haven't been successful at it. However, I've made some changes and started out at 219, and I'm now down. Yesterday I weighed myself at 180. So how do people really know if they have leaky gut? You know, how do they find out? And or is it just something that they automatically have from certain conditions? For example, you know, bloating, inflammation, so forth and so on.
Right. Well, again, we talked about the large amount of populace that would have this leaky gut, and we're even talking about children. So, we have many adults on line here listening to our conversation this evening, but we also have to take a look at our children. And so things like not being able to focus, retention, issues in class can be leaky gut issues. Things like bloating, gas, and cramps. Those also can lead to or be symptomology of leaky gut. Food sensitivities, joint pains and aches. I can't begin to tell you how many patients we see that do not put their pain level and associate it with a leaky gut or food intake. And so those are some pretty basic things. Headaches would be another, fatigue, lack of focus, even anxiety, depression, those type of things fall in line.
Wow, that's a lot. That's an awful lot. So I understand that there's a 3-day detox program that people are doing out there. Can you share with us why detox? What's the purpose of this? Because I know that people don't like 30-day detoxes, and there's that tug of war. But there's been a lot of success with this 3-day detox program. Share with us, please.
It is, because detoxing is critical. And so, detoxing the body of toxins helps the body run better. I usually teach my patients our body's like a car, and we wouldn't drive our car and then all of a sudden the check engine light comes on and we pull over and put masking tape on it and just keep driving our car. We'll take it to the garage and have it checked out. And so we have lots of check engine lights that are happening within our body, from the symptoms that I had talked about, the issues that people could feel. As adults, we seem to reason them away. Oh, I didn't sleep well, or I'm under stress, or, we don't put 2 and 2 together. And so detoxing the body is really critical from those toxins to help our body run better. And like you said, most people don't want to have to deal with 2, 3, or even a month detox. It's pretty overwhelming. So a 3-day detox that can be enough to really get a person rebooted and back on track is adequate, and it's something a person can do over a weekend, so it doesn't take away from a busy lifestyle or their work.
Awesome. That's great. And I will attest, I've done the 3-day detox, and it is pretty amazing. So that's great, because you actually eat on the detox, and you eat really good food, top quality food, as far as, more on the plant-based, as well as, good proteins and beans and things like that, legumes, so forth and so on. So we've heard about some protocols that people are doing, and there seems to be so much information regarding this, and what people should follow, what they shouldn't follow, what they should know, what they should not know. How do we, affect leaky gut in a positive way? And what are the steps that we should take to reducing inflammation, which seems to be the catalyst to, all of these different symptoms that we're having? It's a different type of inflammation that we get from that.
Correct. So some of the things that we would want to do is really focus on our gut. So we want to change to an eating plan that would be more anti-inflammatory. We don't really realize how much processed foods out there in this country. We have over 3,000 chemical preservatives and additives to our food compared to the next country. And so all that creates internal gut inflammation and how our body reacts to it. So remember, we can all be a same blood type and eat the same product and end up having a complication by having an adverse reaction, whether it be a migraine headache or fatigue or joint pain, because we're all genetically different. So it's really important that we take a look at that. And then in order to lose weight, and I want to congratulate you on your weight loss, but in order to even lose something so simple as weight, is you have to reduce the inflammation. You can take a pill, you can take a shake all day long, but if you don't address the gut and how the gut not only digests, assimilates, and eliminates, you're not going to have what you're looking for in long-term benefits. So, we want to use things that bring down the inflammation. So we want to look at the food intake. We want to do things that would enhance function, so that communication network from the small intestine to the brain is there, because that's everything. If our gut is not functioning well, neither is our brain. And so it's really important that we hone in nutritively feeding ourselves. And sometimes it takes outside sources. So when I deal with my patients, if you did it in food alone, it could take a long time. So you want to address food, but you want to also use some adjunct things to be able to enhance that benefit of reduction of inflammation so that you see results quicker.
Exactly. That's great. So, everybody knows the saying, you are what you eat, but really today it's you are what you digest. And with this leaky gut situation, so many people are not really properly digesting the nutrients because of the chemicals in the preservatives that are in many of the foods that we eat. So in order to really clean it up relatively quickly, because as you said, food alone will not do that, people are hearing more about probiotics. Can you share with the listeners about probiotics and how do they help?
Well, if we have any germaphobe people out there, I want you to cover your ears really quick, because the super interesting thing is we have over 40 billion different types of bacteria that live in our body and on our body, but the majority of that bacteria actually live in our gut. And so I call them gut buddies. And so we have good gut buddies and we have bad gut buddies. And so in probiotics, those are our good gut buddies. And so when we have things that we talked about, whether we use antibiotics, whether we use long-term NSAIDs like your Tylenol, your ibuprofen, we upset that flora. So probiotics are critical. Plus, most people don't understand that roughly 80% of your immune system is your gut. So it's critical that we focus on it. So whether you have any kind of autoimmune condition, whether you have mental lack of mental clarity, headaches, those type of things, joint pain, you want to change the flora in that gut. And so probiotics are critical. We have specific strains. So everybody knows specific strains such as bifidus and lactobacillus. Those are the most common ones that we hear. We read about them in the news. But there are many different strains. We just think that we'll go and get one, but there's multiple strains. We have lactobacillus that actually help with diarrhea. And then we have lactobacillus that helps with constipation. Well, if you're an individual that's more constipated, you definitely don't want to take a probiotic that's high in a lactobacillus that helps with diarrhea, right? And so it's really important to have the correct strains in your product that you're using. And then I use a product that we enjoy a lot that is specific strains that are geared to the neurotransmitters in the gut. And that's powerful. And that's why it's really critical that we know what's in the probiotic we're taking. Plus, we want to make sure that it's stable and it makes it through into the intestinal tract. Because of the mouth and the stomach acids, probiotics are very, very tricky. And so it's important that they're stable enough to make it through that stomach acid so that you have good implantation, or we call it reseeding the gut. It's important that we reseed that gut. And so oftentimes we think about winter and we think about colds and flus, and we think that, the issue is that, we're not outside. Vitamin D is critical, but also the flora in our gut is critical, because what do we do more in the wintertime? We have lots, we're entering the holiday season. What are we intaking more? Sugars. So awesome. It does play a huge role in the gut flora.
Awesome. And there's so many products out there, in the market, and what I've come to learn is that the products that we're using are basically focused at the strain level of a specific species, which is associated with a genome. So I look at it, in layman's term, you've got the cat, then you've got, the tiger, the leopard, so forth and so on. Each of those have their own certain bacteria that's associated with them, but then there's that strain that's specific to each of those species, and that's the level that we're getting at in regards to our science-backed and clinically trialed products. Would that be a correct assumption?
That is fantastic. It's well put, yes.
Awesome. Awesome. Well, you've come up with some really incredible pieces of information tonight. What I'd like to do is introduce Patti Sinclair, who is from Connecticut. And she is coming on board to provide some personal testimonials for our listeners out there. And Patti, if you could just share some of your thoughts and some of the experiences that you've had over the last several months in regards to some of the issues that you personally are addressing.
My screen is frozen. Hang on.
No, you're all right. Go ahead.
Can you hear me?
We can hear you.
Yeah, thanks, Jeff. So, I mean, awesome information for everybody tonight. Sorry. You know, I think if you're out here listening and you've struggled with this before, it's really confusing, you know, and what I'm so grateful to Georgia for and all the information that's been provided to us, Jeff, is that finally I feel like I have the answers I've been looking for. I'm 55 years old, so, you know, honestly, since I was about 14, even younger, I've really struggled with gut issues to the point where it's put me in bed. It's caused me to stay at home, fear going far from home, depression, anxiety. And I've never had a Western doctor to tell me just the simple things that Georgia went over right now. I've never, and I've gone in the ambulance. I mean, I've been into the ER several times. I've gone to see specialists. I've never had anyone talk to me simply about what I was taking into my body. And I'm a reasonably healthy person, but I mean, I really needed to make some changes, you know? And I feel like there's so many people out there that are just trying to put a Band-Aid over what's really going on. And our society feeds that. You know, you see the ads on TV and you go into CVS or Rite Aid and the whole aisle for, you know, like you alluded to before, indigestion, acid reflux, you know, it's epidemic, right? And yet there's this kind of feeling like, oh, you can have your booze and your fatty foods and your fried foods, just go and take the purple pill after you're done, you know?
Right.
And so many people do that. And then as Georgia knows, that's just causing so many disease states to proliferate, you know, because then you've just put your entire body at risk. And it's really, I wept when I learned about this product line that has helped to heal me, you know, and I use that. I'm not making any claims as much as I'm off 99% of the medication that I was using. I go free through my day without any issue. I'm not worried anymore about, you know, where the bathroom is here or there, or if I'm going to wake up with cramping or, you know, it's just been remarkable. And it does make you a little bit angry when you find out at first, because you're like, why didn't anybody tell me this? You know, how is it that I didn't know this? And so I am incredibly passionate now because one of the things that I've shared, Jeff, you know, is that I've been an anxiety disorder sufferer since I'm, you know, about 13 or 14, really seriously with intense panic attacks. But ever since I was a little girl, and we won't talk about it tonight so much, but, you know, I suffered from a chronic strep throat situation from when I was a baby and was on penicillin, amoxicillin almost yearly, if not every 8 months or so, for about 7 years of my life. And so now that I understand how antibiotics go in and ruin all the flora, good and bad, and we never had ways back in the day, you know, when I would feel better and I could swallow after the strep throat was done, my mom was like, you want to go get pizza and a Dairy Queen? You know, so my poor belly was getting sugar and processed foods on top of just trying to start to heal. So I love that we're here to be able to tell our stories, and whether the person that's listening is looking to drop some weight, feel better mentally, your gut is in trouble. You know, tonight we're obviously talking about leaky gut, but the root of the problem has been uncovered, you know, and that's what we're here to really help people, you know, bit by bit understand how they can get well. So excited about it.
Awesome. Well, thank you for sharing, Patti. I really appreciate it. And Georgia, thank you for your time. It's valuable information. I hope everybody here on the Zoom call this evening got some really good nuggets. And for those of you who were invited through other individuals, please get back to them. If you're on through Patti, myself, or Dr. Georgia, get back to them, and stay tuned next week, or excuse me, 2 weeks from tonight at 7 p.m. We'll be sending out another notification, and we'll let you know what that series 2 is going to be. So any last minute thoughts, Dr. Georgia, for our listeners? We have about 2 more minutes that we have. Oh, unmute yourself.
Unmute, sorry. I was looking at what somebody else said. Yes. So, you know, if you're questioning that you may have some issues here, don't hesitate. I mean, we all fall into that gap, and it's very interesting that for years, I actually had a cancer patient that came to me, and we talked about the gut, brought in a book and said, why didn't anybody tell me? And so, you know, we want to be able to educate those listeners so that you can retain and enhance your health. And I'm just excited to be a part of it. I'm thankful, Jeff, that you asked me to be part of this series.
Oh, thank you. And Lynn, for some reason, my chat box did not come up, and I do see that there are some comments in here, so I will follow up with those people that came on board for me. Well, we got a second here. Are there blood tests or other tests that show what our microbiome consists of and whether it's in balance? Dr. Georgia?
Yes. Yes, there are. We actually use a test called the Nutrimetrics test, and then there's actually one that's actually done through uBiome that you can utilize, and it'll tell you where your upset is and what you should do as far as know what the negative bacteria is in your gut.
Okay, and that was the Nutrimetric test?
Yes, or I'm sorry, a Nutravel. I call it a Nutrimetric. It's called a Nutravel. We do that in our office. It actually will tell even more than just the gut biome and what the overgrowth is. We can actually look at what you're lacking nutritively as well because of the dysbiosis that you're dealing with.
And that's Nutravel?
Nutraeval, EVAL.
Like
Okay, gotcha.
Yeah.
I just put it in the okay. Thanks, Michelle.
Yeah, you will not find it through the blood. It's actually factored through the stool because they're looking for growth that is seated in there.
Got it. All right. Awesome. So we're at the top of the half hour, and 7:30. So thank you all for joining us, and I will have this out in a recording. And if you do want that recording, please reach out to either myself, Patti, or Dr. Georgia. So thank you all for coming, and we look forward to seeing you the next time. Thanks.
Bye, everybody.
Bye.